Dr. Patel, if a patient is or has been part of a clinical trial involving CAR T, how long will that patient be followed under the clinical trial protocol for long-term effects? And this is especially important for people who see community oncologists and are wondering about any latent effects that they might experience. How long will those clinical trials follow those patients?
That's a great question. So most trials will follow for at least 2 years just for um, toxicity efficacy. Now, most trials will follow until you're relapsing, right? So that's the point, is that we want to make sure this is working, that you don't have any long-term toxicity. And when you relapse, we call that, the progression-free survival, which is what most of the trials are looking at. And once you relapse, usually they'll say, okay, you're coming off trial because now you need other therapy, right? And that could take years. However, for all CAR T products, because these are genetically modified, the FDA requires that you go onto a long-term protocol where we're monitoring for potential leukemias or lymphomas that T cells can cause, theoretically. So that is for 15 years total. So, everyone then is supposed to go on to that. Now, we can't force you to go on to those, but it is something important because it's come up recently that maybe, some of these T cell products are leading to leukemia or lymphoma. Because we're modifying those T cells, could they themselves turn into a cell that causes cancer? The theoretical risk has always been there. I will tell you that in reality, yes, there have been probably a handful of patients out of all the lymphoma and myeloma and leukemia patients who have been treated with CAR T, where maybe it came from the T cell itself, the actual CAR T. The majority of other cases that have been reported, it's been low risk. It's less than what we usually see in the general population of patients with heme cancers, blood cancers that get other blood cancers. But when we see it, most of the time it's not in the T cell where the CAR was in, right? But again, a handful have been. And that is really why, as a group, we have to be really careful and make sure that, some of these the way we make CAR Ts is very different amongst the products, and to make sure that one product versus another isn't more likely to cause T cell leukemias or lymphomas. So that's the main reason why that 15-year protocol exists.
And do you have any tips for patients who maybe have undergone CAR T therapy, are several years out, working with their community oncologists? At what should they be watching for in terms of any latent side effects or long-term side effects?
Yeah, so I think the activation tip here for long-term side effects really is infections, number one, because even after, I just saw a patient last week whose IgG level is still less than 100, even a year after CAR T. We've just knocked out the good and the bad, right? And so there's just a higher risk of infections. So we try to prevent by giving IVIG regularly. And so again, anytime you get an infection, just talk to your doctors. Don't say this is just a cold. Just make sure that someone's following. And the other big thing is your blood count. So if your blood counts start doing something crazy, your white count's getting high or too low, you're not on any therapy, your hemoglobin's getting really low, your platelets are getting low, that's where we want to make sure there's not a secondary cancer, a secondary blood cancer involved. Again, T cell leukemia lymphoma is really rare, but we have seen 10% patients with MDS or AML in the relapse refractory population. So that is something else we would still want to watch out for and make sure we don't miss that.